Of the next 3 months, we will lose the public goodwill on this program completely. Doesn't matter what we do after that. So, and the more reason why I think we should adjourn so that we can fix what needs to be fixed and come here and make final and binding resolutions and move on. I also, in terms of reporting progress, it is important for us to report to the country that the registration seems to be picking up well, 19.5 million, fairly okay, comparing that only 9 million Kenyans were registered before under NHIF. We still have issues, as was communicated by the chair of the COG on health, that in some of the data we migrated from NHIF is incomplete because only the principal beneficiaries are part of that system. And we need again in the next week or so to bring in the dependents, the other beneficiaries, the dependents of the principal beneficiaries, and we have to crack our heads and find out how we go about that. But 19.5 million, up from 9 million under NHIF, in 4 months, 5 months, is a good trial. Secondly, that we, and when I say we, I mean the national government and county governments, have been receiving public and stakeholder feedback and taking that feedback very seriously. The evidence is first in the review of the means testing tool, which is ongoing, and which has a non-extendable deadline of 28 February. We must have fixed the review process of the means testing tool to provide for an objective data-based tool that is not susceptible to manipulation whatsoever, an objective data-based means assessment tool that will give a clear and scientific assessment and thereby generate a predictable premium assessment of who needs to pay how much. Again, without any extension, and I mean this, all those who are involved, there will be no single extension, there will be no explanation. We will need to have that tool in place by 28th of February. Other than that, other than reviewing the means testing tool, after listening to stakeholders, beneficiaries' experience, and members of the public generally, the government has adjusted in the interim the funding arrangements for the program through the supplementary budget to be tabled in the National Assembly tomorrow. And in that connection, the 3 areas that have been given additional funding include more funding to the Chronic and Critical Illness Fund, which is going to receive an additional 3 billion shillings, because the feedback we were getting from the public and stakeholders is that we needed to adjust the funding and the financing around chronic diseases and critical care cases. So through tomorrow's supplementary budget, we will be adjusting that fund by 3 billion shillings. Equally, the government has decided to again review the funding of the primary health care fund by another 3 billion shillings. And finally, the same supplementary budget will provide an additional 1.8 billion shillings to take care of maternity-related health services, including the issue of Linda Mama, and that includes our teenage girls and the pregnancies associated with teenagers. So that is a total of 7.8 billion shillings as a short-term adjustment to make sure that this program works for the benefit of the people of Kenya. The other thing where we need to make a lot of progress and rapid progress is in the onboarding of all health facilities. And that's why in our reconvened summit, we will need a clear output in the form of all the level 2, 3, and 4 facilities across the country being onboarded for purposes of capitation and for purposes of making sure that we sustain this program at those levels. I want to urge the 2 levels of government to continue working together. None of us can implement this alone. And I want to emphasize what has been said by other speakers, that we are not adversaries, we are partners. And we do appreciate that much of health is devolved. But we also do appreciate that the national government must backstop county governments on critical areas like equipment because of economies of scale. National government is the only underwriter for county governments to make sure that scale doesn't cost us program deliverables. Not just around equipment, but also the issue of health commodities. We may need to make a quick resolution on what to do with the KEMSA debts. And I thought I would hear today whether this summit will agree on the way of recovering the KEMSA debt so that the health commodities supply becomes predictable as a core component of the delivery of this program. So there are so many things out there. I have recorded about 48 interventions. Some are small, others are big, others are in between. Some are administrative, others are financial. Some are in equipment, others in human resource, others in financing. And therefore we must follow through this if this program has to work, and the program has to work. Let me leave it there for now. I want to persuade you. Even if we added more time, we will not resolve these issues. I want us to work through our respective collaborative avenues, through the COG, Secretariat, and my office, on behalf of the agencies of the national government, to work out some of the things that we can work out in the interim before the resumption of the summit. Number 2, I commit the summit will have not less than 18 hours of work, so that after that meeting, we don't revisit, especially these very preliminary issues around the implementation of the program. Number 3, in the resumed sitting, we would want Parliament to be part and parcel of this discussion, so that in future, even if we need legislative and budgetary support, then they see themselves as partners, equal partners in the delivery of this program. And they should not see it as an executive intervention from the 2 levels of government. I am persuaded, unless I am proved wrong, we need to do a lot of work, especially the efficiency aspects at the 2 authorities, the Social Health Authority and the Digital Health Authority. Let us stop defending ourselves, and let us take criticisms and feedback positively. If you're doing well, the public will not complain. The governors will not complain. The other stakeholder will not complain. If you hear complaints, it means there is something we can do better. So that's the approach I want us to take. I know the ministry is also slightly defensive. let's accept that there is something that we are doing okay, but we can do better, because even the best can be made better. So I want to leave it at that point and respectively submit that we adjourn, and I want to ask the COG chair to close for us in a minute. There is lunch, which is informal. We will not have a press conference because this summit will continue, but already the progress is in the supplementary budget interventions. The progress is in the 19.5 registration, with a target of bringing on board other beneficiaries, dependents. And one last thing is that there was some reports about the number of people who are paying their premiums. And I want to put it on record that out of the 19.5 million registered under Taifa Care, only 3.5 million are paying their premiums. Another 1.5 million are indigents, even under the existing tool, means assessment tool. We have just discussed with Waziri there and the team how we will make it predictable for county governments to know the amount they need to pay for the indigents. I think we'll handle that administratively. And then another 14.5 million who are registered are only benefiting from primary health care. The primary health care services are available to all registered SHA beneficiaries. So the 14.5 are benefiting only from primary health care, meaning for them to access secondary health care in the level 4, 5, 6 hospitals, they will need to pay. They will need to pay. Other than that, from 1st of March, upon the conclusion of an objective, data-based, predictable means assessment tool, we'll roll out a huge national campaign to make sure that we shoot up those numbers, and then by that time the premiums will be predictable. We'll have enough resources to run the program. I want to thank once more all the governors for utmost cooperation, understanding, and good faith. We thank you, governors, for bearing with all of us, even as we try to perfect this important national undertaking. I want to particularly thank the President's advisory team, led by Moses Kuria, for total commitment and singular dedication. You know, Moses has told us wherever you require him, he wants to be the PA of every governor, every person who needs help to get UHC working. Asante Moses. It takes a lot of humility for someone who has served as a minister of government to run around doing things like those. That's what we are lacking in public service, because everybody's a big man. Everybody's big, they can't do small things, and they are waiting to be briefed. In the process, you end up getting a lot of briefings which are not accurate. So Moses, thank you for being hands-on. And I know you would have wanted to talk today, but don't worry, you will talk in the next meeting. Who has talked for you? Abdul Swamad has talked for you. Because, and pongezi Governor Nasir, I don't want to say we went to the same school with you, but at 50+%, it means every other county can reach there. It's very possible. And there is no difference between governor for Mombasa and any other governor. So I think we should also challenge each other, benchmark from each other, learn from each other, and this program is going to succeed. COG Chair, please come and close for us. I'm afraid we have to leave it there.
There.
Yes.
There's nothing much for me to say after your wrap-up. It suffices. all I'll say is, governors, also let's look at our systems, especially with respect to pushing more claims, notwithstanding the challenges. Let's sweat our teams to also compete for the claim spot. Your Excellency, you've wrapped it up well for us. It will suffice. Thanks for your stewardship.
Parting shot, the universal health coverage, Taifa Care, is a public medical insurance program. I am persuaded by the governors that we need to be careful so that the things that made UNHF have problems do not visit us under this program. And therefore, with a lot of respect to private and non-public health service providers, we will need to be persuaded if more SHA members are attending private and faith-based institutions as opposed to the thousands of public institutions scattered all over the country. So we need to be careful. Let's not be defensive, but we do appreciate the input of faith-based and private institutions in the delivery of the program. But when you have a program of this nature and you're making payments and 11 billion goes to one sector of the health facilities and the public facility in a public medical scheme is this little, we need to be careful. And therefore, we'll be giving administrative solutions. This one doesn't require a meeting. We will give directives. And please, let's put each other on toes. Okay? Yes, let's put each other on toes, especially our colleagues in national government, PSS, heads of agencies. This is not a laughing matter. We are just living on borrowed time. We have struggled with this thing for a while. The opposition was huge. These Excellency governors and their teams, they really stood with us as national government when we needed friends. That goodwill, we should not erode it, because increasingly now those headwinds that were with us 4 months ago when we were starting, they are beginning to creep back. So we will do what we must. Harry and Waziri, you know what we agreed in our separate meeting. So from now henceforth, all meetings, including technical meetings, will be held here. Here. Every meeting, ya SHA hapa. Even when your teams are meeting, here. There is that little matter of bringing together Kenya Power, and I'm also reminded that we have money to connect all the facilities with the internet and power, and we need that information already. We have money to connect every facility with power, and we need 2.5 billion, but we just need the information so that we share with KPLC both for internet and for electricity. With those many remarks, asanteni sana. Karibuni, kuna lunch. The lunch is informal. You enter, eat and leave at your pleasure. God bless you and thank you for coming. Thank you.
Thank you, Your Excellency. Kindly, kama bado tumetulia tuliko.